In 30 years, patients will come in for the first time, and it'll be their initial experience with a plastic surgeon. I might be the fourth or fifth plastic surgeon that someone sees. And I think there's one thing that really is reassuring to patients is if they can talk to another patient. In other words, a patient relating to another patient. They talk to a doctor, it's a doctor-patient relationship. But I have always in my practice said to people, would you like to speak to another patient who's had a breast augmentation or a facelift? And many times they say, yes, that would be wonderful. So we respect confidentiality, so we call patients, say, Betty, I have a patient who wants to think of a breast aug, would you mind talking to them? No, Dr. Brueck, I'd be happy to. And so the whole purpose behind these testimonials is to give you real life patients discussing their experience, their results, their motivations for having plastic surgery. And of course we all have different reasons as to why we want this done or that done. And I always tell people, everybody has something that they wish they could change. When was the first time you sought out a plastic surgeon?
I believe that was in 99, 2000 was the first time. And it was a referral from someone who worked at his office. So that was the first time that I'd ever talked to anybody about doing a breast augmentation.
And how long had you been thinking about it?
Oh, years. Years and years, and I just couldn't quite afford it at the time that I first thought about it. So when I finally was able to do so, that was the only person I had talked with.
So you never went around and talked to Dr. Jones and Dr. Smith and Dr. Bill or anything like that?
No. So I was really very naive about the whole procedures, and I didn't know there were different ways to do it, different types. I wasn't quite familiar. I didn't ask the right questions. I just basically went to a doctor. He said, this is what we're going to do, and I said, okay.
So you saved all those tough questions for me.
Exactly. Oh, I put you to work on.
Now let me ask you this. After the surgery, and you were in the recovery phase, what concerned you the most?
Well, probably what concerned me the most was that I wouldn't be able to work out. I wouldn't be able to get back into the physical part of the gym without doing some kind of damage to the breast implants. That was my first major concern. And I will have to say that probably in a year's time, I did start to see where the implants started moving on me. It was for the way that I had the procedure done, and by going through the armpit, through the axillary area, that they did start shifting.
Laterally, off to the side.
Yes, and so it started happening, I would say, a year after the procedure. And so then it really became a concern, but then what could I do?
Let me ask you this. What prompted you to seek another opinion?
Well, it had been now 10 years for me to have the current implants that that's when I came and talked to you.
Well, how did you get my name?
Well, I had known that you had been in this area for a very long time. So I probably, now that I was a little wiser and thinking about now you can really do research with the doctors and so forth, I just had known that this office had been here for a very long time. And then also I had gone to the rejuvenation spa and seen Andrea for my Botox. So there was my connection.
Now let me ask you this. How would you rate your initial experience with me?
Oh, it was
Coming
awesome.
in for the consultation and...
It was awesome. Actually, I think you were the first one to do my Botox, and then I switched over to Andrea. But it just very laid back. I mean, you were very, very kind in answering my questions. You never made me feel rushed, like, oh, I got to hurry up and get to another patient. And so you took the time, and you were honest. And I consulted with you, I think, 3 or 4 times before I actually scheduled the surgery.
It's okay. When the train's ready to leave the station, it'll leave the station and not until then.
Right.
And so sometimes, well, I always feel that sometimes people have to get to that point where they say, I'm comfortable in making that decision. And that comfort level may come after 3 or 4 visits with me.
Mhm.
And you may have 3 or 4 visits with me and decide, I don't want to do anything. And it's okay, because it's not about me, it's about you.
Right.
So, how was, the scheduling of the surgery, then the surgery and the post-op period of time, like 2, 3, 4 weeks post-op? What was your experience then?
Oh, I've just been so elated, and I still am. It's coming up on a year now, and I'm just amazed that I did not research and do the proper things first time around, but I realized that all things happen for a reason, and so now I've gotten the best experience.
Now let me ask you this. What would you recommend to people out there that are contemplating plastic surgery in terms of researching a physician?
Well, as far as the research, yes, I would look and see how long someone has been established in the area, and how many surgeries a person has done. That is foremost. But then I think it's that level of comfortability, of meeting with the doctor,
Right.
talking with the doctor. And you were just always very honest and upfront with me. I mean, you could have told me anything just to, I guess, have a
case.
surgery, right,
Right.
to have a case. But it was always that it's going to be whatever's going to make you happy, Laura. But you were honest in telling me of what happens when implants are put in through the armpit, and what happens with the muscle tissues, and how it makes the passageway, and everything that you had to do to then correct it. And so you didn't try to sugarcoat it, I suppose you could
Yeah.
say it that way, that you told me exactly what it is and what I had to get in for, and everything has happened and worked out exactly the way that you said it would.
Are you back to the gym?
Oh, I've been back. I was back at the gym like a couple
See,
weeks afterwards.
You're
I
a
think
workout. You go back. See,
Yes.
sometimes trying to keep people down for a little bit while their body heals sometimes is difficult. Would you recommend me to other people, friends or family?
Absolutely. And I have already. I mean, and even as far as procedures for Botox or for the Juvederm, because I do that as well, I do highly recommend.
Well, I
Very
appreciate
much
your
so.
kindness. I always tell people when they meet me for the first time, you get 2 things. Number 1, total honesty. I say it the way it is. I don't sugarcoat it. Number 2, I treat you like a family, like you were my daughter. And I feel if you do that to patients, I don't like to, it's not a patient or a number. Technically, you're a patient, but I like to think of my patients more as part of my family. I'm part of your family. And I've been in practice now 30 years, and so there are a lot of people I've done multiple things on, and they've become part of my family and I'm part of theirs. And it's one of the beauties of what I do, and one of the reasons I enjoy it as much as I do.
Well, and it certainly shows.
Laura, let me ask you this. Do you have any question you want to ask me?
No, I don't think so. I mean, as far as, I've just been so happy with the whole procedure, and yet I do know that if anything does come up later, if I have any other questions or concerns about how I'm looking or progressing, I know I can always
I'm
call.
going to ask you a
your
very,
office.
very tough question.
What's that?
Are you doing your exercises on your breasts, massaging?
Do you know, not as often as I should.
Twice a day. Remember what I told you, and I tell this to all my breast augmentation, breast reconstruction patients. Twice a day when you take a shower or a bath, you're in the shower, massage twice a day. Keep them soft.
Okay. Well, they are remaining very soft. I'm so happy with that.
Okay, well you need to keep it that way, okay?
Okay, that's
Great.
great.